Good afternoon and welcome everyone to today's lunchtime seminar. And in this year's National Arts Seminar series, we're going to explore the healing power of creative arts. And here in this first webinar of the series, we're going to be hearing from some researchers on improving mental health and well-being with creative arts. And we've got three short 10-minute talks that explore the impact of the arts on mental health and on well-being of Black young Britain, on asylum seekers and refugees, new mothers, and stroke survivors. Now, my name is Professor Simon Gilbody from the University of York, and I am the co-lead of the NIHR ARC Yorkshire and Humber mental health theme. I'm the Professor of Psychological Medicine and Epidemiology, and I'm an honorary consultant psychiatrist in Bradford District Care Foundation Trust. Now, a little bit about the ARCs before we hear from our speakers. The ARCs, as most of you will know, but it doesn't matter if we were to go over that again, the ARCs are a network of 15 applied research collaborations across the country, and they're funded by the National Institute for Health and Care Research. And they're a research close to the beating heart of health and social care. And NIHR ARCs support applied health and care research across the country. And we're going to place some links so that you can find out a bit more about ARCs if that's something you need to do. But we've got 4 speakers and 3 presentations here today. So just a little bit about our speakers. And the first of our speakers is Dr. Briana Applewhite, who comes from the ARC in Oxford and Thames Valley. And she's going to speak about how creative arts and therapies like music and dance and art and drama can improve the mental well-being of Black young people in the UK. And then next up, we've got NIHR ARCs West's Dr. Christalla Pithara-McKeown, and that's going to be on supporting the mental health adult asylum seekers and refugees through community music groups. And then finally, we've got 2 presentations, so 2 presenters and 1 presentation, a joint presentation from the ARC South London, and that's going to be from Dr. Tony Woods and Professor Ioannis Bakolis on the world's largest hybrid study on the impacts of arts and mental health embedded into a national healthcare system. So, very quickly going to move on to our first speaker, and that's going to be Briana Applewhite, and she's a DPhil student, a doctoral student at the University of Oxford in the Department of Psychiatry. And Briana's research focuses on culturally competent therapeutic solutions for Black British youth, namely with creative arts therapies and the exploration of these as an adjunct and effective treatment method. So I'm going to pass over to Briana, and I'm very excited about this presentation. So Briana, you've got the hot spot. Over to you.
Amazing. Thank you so much, Simon. I am just going to share my screen. Good. Great. Thanks so much, Simon, for that wonderful introduction. I'm not quite a doctor yet, but very well on the path to being. I'm a 3rd-year DPhil candidate at the University of Oxford in the Department of Psychiatry. I've been supported by the ARC for the entirety of my DPhil, so very excited to share with you my work today. So Simon's done a brief overview, but I'll just jump right in and start with some unfortunate, harrowing statistics about Black mental health disparities, specifically in the UK. So as you can see here, Black British people continue to suffer from poor mental health outcomes in comparison to white counterparts within the UK. PTSD symptoms, 8% of Black British people suffer a doubled rate in comparison to white counterparts. In terms of psychosis and schizophrenia, diagnosis rates are 6 times higher within Black British individuals versus their white counterparts. And gender disparities exist with these populations as well. As you can see, 29% of Black British women will be diagnosed with a common mental disorder at some point in their lifetime versus 21% white British women. So in terms of what is currently ongoing, NHS mental health services primarily consist of talking therapies, but are talking therapies actually effective for these populations? So as you can see here, Black people are less likely to use NHS talking therapies, specifically CBT services. They're less likely to complete treatment when they actually do sign up for services. And when they start treatment, they're less likely to improve or achieve a full recovery. So what does all this mean in terms of creative arts therapies? So creative arts therapies involve art activities that utilize visual arts, dance, music, and drama, but they've been shown to reduce symptoms of depression, anxiety, also even in schizophrenia and psychosis. But specifically in African and Caribbean populations, creative arts are utilized within day-to-day life, whether that's with music, whether that's in dance. But these populations don't actually consider them or call them therapies, even though they utilize them within day-to-day life. So the idea here is cultural competence in healthcare. Can we actually provide culturally competent healthcare that utilizes things that are culturally relevant for these populations? So cultural competence, just a brief definition, is providing care that respects patient diversity, whether that's through language, beliefs, attitudes, communication styles, or behaviors. And why this really matters specifically for this population is it provides and delivers effective clinical care, and care that is actually relevant and supports different patients from different backgrounds. So the overarching research question here is, can creative arts therapies offer culturally competent mental health support for Black British individuals? So my work has been focused in 3 different phases. The first phase has been a meta-analysis that I started within the first year of my DPhil. And this meta-analysis was assessing if creative arts and creative arts-based interventions can be effective for young people with PTSD. You may be asking why PTSD specifically. Well, as I said at the beginning of the presentation, Black British individuals will be diagnosed at an 8% rate in their adulthood in comparison to 4% for white British individuals. So we looked at a total of 33 studies composing of 4,500 participants aged 3 to 18. Within this meta-analysis, we actually saw a reduction in PTSD symptoms when creative arts were utilized in any sort of intervention. But to take it a step further, we did a subgroup analysis by world region. So homogeneous samples of African individuals were assessed to see if PTSD scores decreased at higher rates. And that was the case here. So when a creative arts-based intervention was utilized, PTSD scores drastically decreased in African populations versus other ethnic groups. So the hypothesis of, are creative arts culturally relevant, definitely stands with the results that we've seen in the meta-analysis. But with the second phase of my DPhil work, we've taken it to a series of focus groups with NHS mental health patients, but also clinicians. So we wanted to ask the perspectives of Black young people that were in NHS mental health services about their current clinical care, but also if they view creative arts therapies as culturally competent, specifically for enhancing their mental well-being. So we spoke to a total of 38 participants, 20 Black young people aged 16 to 24, and then also 18 clinicians working in NHS mental health services. Some of the themes that arose within these focus groups were the value of arts-based therapies, certain critiques of current clinical care, again, echoing the sentiment of them not being necessarily effective as Black British people, and then finally the cultural relevance of creative arts therapies and if they can be effective solutions as adjunct treatments taking things forward in mental health services. So I'd just like to go over some quotes from the results that we'd seen from these focus groups. So as I mentioned before, one of the main themes was the value of arts therapies. As you see here, a quote from a clinician is, "I feel it breaks a lot of barriers and it's something almost every patient can relate to. So it doesn't matter your background, your color, or your religion." And then a secondary theme here was, of course, the cultural relevancy specifically for Black British youth. One patient actually said, "It's something that's taught me something about myself and my roots," when referencing music, specifically as a Caribbean person. And then a second patient said, "I know how much art, music, and dance means to us. It's ingrained. I would love to see this happening in our services." So some really good insights coming out of those focus groups about the relevancy of creative arts therapies and ways to take them forward, specifically in mental health services. But to close, I've actually done the final phase with the pilot study, and this was with a community organization called Grounded Sounds. Grounded Sounds is a South London-based charity in Brixton, London. And Grounded Sounds has been doing phenomenal work over the past 10 years with young people within Brixton and South London as a whole. But we collaborated on a project called Spotlight. And Spotlight was a 12-week music program where young people were able to learn musicianship skills from artist development to singing, songwriting, to actually at the end of the 12 weeks performing in front of their community, all of the things that they learned in terms of musicianship skills. My role within this was tracing the psychological symptoms within these young people. So the PCL5, symptoms of trauma, PHQ-8, symptoms of depression, GAD-7, anxiety, and the SWIMS, which is a quality of life scale. And as you can see from the results here, the PHQ scores were symptoms of depression. They decreased for the entirety of participants within the program. This was the exact same for symptoms of anxiety and also trauma. They decreased quite largely through participants actually doing the program with Grounded Sounds. So you can see there's real value with learning music and having those skills and it decreasing different common mental disorders throughout the way. And in terms of SWIMS, this was quality of life. So as you can see here, each participant actually increased their quality of life throughout the time that they actually participated within this program. So we have some really good data about how music can be effective, particularly for Black British young people suffering from different common mental disorders. But what are the key takeaways here? So creative arts therapies are definitely something that should be explored in terms of Black British youth's mental well-being. From the focus groups and the meta-analyses, and you can see from the pilot study, it seems to be really effective for these and reducing symptoms that these individuals are suffering with. And then also community-based interventions. We talked about the cultural relevancy of, maybe NHS mental health services not being the correct setting to undergo, different talking therapies and things like that. But maybe doing community interventions like with Grounded Sounds that are culturally relevant. This could be a way to start the conversations with these young people and do work that seems culturally relevant for them. And then finally, taking this a further step within RCT, where we're able to explore this on a larger scale. As you saw, we only had 5 participants for the pilot study, but in a subsequent postdoc, we're hoping to take this further to sign on more participants so we can actually see the alleviation of these psychological symptoms and how creative arts have been effective for these young people. So I would be remiss not to acknowledgements to everyone that's assisted along the way. As you can see, it's a large spread of individuals here that I'm very grateful and thankful for their time and assistance with all the work that's been ongoing. And I would like to end there with some questions, if you'd have any. Thank you.
Okay, so soon to be Dr. Briana, thank you so much for your presentation. That was a joy to behold. So I was so excited and interested, and a particular thank you for me for keeping to time. That means that we've got time for 2 or 3 questions. So we've got some questions in the chat. So I'm going to filter those and ask those of you. So the first question comes from Betty Hiley Shaw, and Betty asks, have you been able to see the difference between creative art therapies impacting on mental health? Or are the studies just an overview of creative art therapies rather than individual therapies? So it's a lumping and splitting kind of question.
Right. And if I'm not mistaken, I think Betty's asking the difference between if music or dance or visual arts were more effective versus the other. And that was also tackled within that meta-analysis. So we actually saw that a mixture of many things together was actually the most effective with reducing these symptoms. There was no one that was more effective than the other. So again, we have this question of, is it actually the creative arts, or is it the community aspect, or really doing something nonverbal where you don't have to articulate your feelings in a setting that could be a bit jarring? So yeah, that's a great question, but it seemed to be a mixture of many different modalities at once that was the most effective.
That's great. Great question. Great answer. So we've got two comments in the box from Professor Vicky Carco. So Vicky comes from Edge Hill University, and the first is, I think Vicky wants to chat with you after this. So here in my matchmaking function, pick up the conversation with Vicky after this. But she does ask a very specific question, and that is, it will be interesting to clarify whether your work included creative arts therapies such as HCPC registered or similar professionals, or were they arts-based interventions that are used therapeutically by a diverse professional group of artists or performers?
That's a great question, and one we definitely tackled within the meta-analysis. So there were a series of interventions that utilized creative arts-based interventions, which weren't necessarily done by a certified creative arts therapist. And we actually saw that the effect was really no different when a registered creative arts therapist was utilizing or doing an intervention versus one that was a community-based person that was trained up to do the intervention. But especially with the pilot study, it was community individuals that were doing the work with grounded sounds. So they weren't registered creative arts therapists, but definitely taking that forward with the RCT to see if there's really some differences there that we can highlight of if, creative arts therapists registered have a bit more impact versus the community kind of interventions that I've been focusing on.
Right.
But we can definitely chat.
Now, I can see there's a question from my friend and former running partner, Professor Paul McKeown. So Paul McKeown is an esteemed economist, and you'll be able to guess that by the question. So he says, these interventions look great. So I'd agree. So Paul's question is about supply and demand. So he says, can you say something about waiting time for these? Are there shortages of arts-based therapies?
Yes, most definitely. So for the focus groups, we were speaking to creative arts therapists specifically. And it was even difficult to schedule the groups because of how busy they were and how much demand there was within services. I would say that they don't exist in all NHS mental health services within the UK. So there's specific trusts that actually have arts-based therapists currently. So of course there is high demand, but there's also a shortage of individuals that are employed by the NHS to do this work. So there's something to be said about maybe hiring up and training more individuals to do this support across the entirety of the UK, instead of just selecting different trusts that they actually do these services with. Yes, but there's definitely a shortage and a high demand, to say it.
Great answer and a great question, and it's nice to connect with Paul again. So that's the end of your questions. So thank you for fielding your questions. Thank you for our contributors and people that have posed questions. I'm sorry we weren't able to ask them all, but we are now going to move on to the second talk. So thank you, Briana. Good luck with your PhD and your defense of your thesis. I'm sure you'll be fine.
Thank you so much, Simon. Thank you.
And we're going to move on to our second speaker, which is Dr. Christalla Pithara-McKeown. So Christalla will correct me, but she is a senior research associate with NIHR ARC West, based at the University of Bristol's Medical School in the Population Health Sciences Centre. So Christalla has experience in conducting qualitative healthcare research, in particular the use of qualitative research methods to inform healthcare service evaluation. And Christalla has particular interest in the application of behavioural and social science methodologies and approaches to healthcare research, particularly approaches to Pacific health justice. So Christalla is going to speak about supporting the mental health of adult asylum seekers and refugees through a community music group. So we're looking forward to hearing about Christalla's work. So over to you, Christalla.
Thank you, Simon, for the introduction. It is my Q1.
Thank you.
I'm going to share my slides now. Today I'm here to talk about the work that we've carried out here at NIHR ARC West, which was looking at the impact of a community music group on the mental health of asylum seekers and refugees. And just to point out that this is a bit of, it's a kind of a different sort of issue we're talking about, because this community music group isn't an intervention, but we're talking about the work of a charity. So just to say that today I'm talking on behalf of a group of researchers and collaborators, including the Dovetail Orchestra. And before I move on to talk about our project, just to say that I'm going to say a few things about the Dovetail Orchestra, its aims, its activities, and before saying a few things about refugee mental health. And just to say that the Dovetail Orchestra is a charity that exists to provide a welcoming space for asylum seekers and refugees. It aims to build connections through music and support musical learning on a regular weekly basis. The orchestra is open to all refugees regardless of music skills and regardless of music knowledge. And it provides certain opportunities for people to develop their music competencies, their music knowledge through one-to-one training, teaching, mentoring, and also access to learning materials and instruments that people can take home to practice. Now, this is an overview of the activities of the orchestra. And in addition to the weekly workshops and the opportunities for socializing as part of tea and cake meetings after the rehearsals, which are in collaboration with a local community organization, the orchestra also gives concerts to the community, but also that are open to the public. It participates in festivals and other music activities. Now, when our team first got together to talk about our project, think about the scope and the focus of our research and how an evaluation of this community music group would look like, we focused on the themes of social belonging, the connections, of inclusion, and as well as mental health. And as well as the music component, which was basically the focus of the orchestra, as in developing music and giving space for people to participate in music co-production. And we thought that the issues that we talked about very much related to the social determinants of health. And looking at the literature, we can see how refugees experience disproportionate risk for poor mental health, and including loneliness, isolation, loss, trauma, discrimination, and stigma. We can also see that they experience considerable inequities in terms of mental health outcomes, in being more likely to be diagnosed, for example, post-traumatic stress disorder and depressive disorders. And we're thinking of mental health as a component, as part of well-being, and we're thinking of well-being in terms of human flourishing and the ability to contribute with a sense of meaning and purpose. And therefore, we see social and cultural participation are really important for well-being. They can be a resource to improve and protect mental health and well-being. And in the case of refugees, they are also a core component of integration policy, whereby social connections and relationships, participation in social life, and leisure being a space where social connections can take place, relationships can develop, as well as a goal and an outcome of integration. So that we see particularly for refugee communities, government policy for integration and well-being sort of come together in that space of social and cultural participation. When thinking about those themes, we decided that a capabilities approach would be most useful for informing our methodologies. And this is because of how the capabilities approach understands well-being in terms of human flourishing, but also how it focuses the assessment and evaluation of well-being in terms of the means available to people, both the resources and in terms of the personal, social and environmental factors specific to the individual and their context that enables them to undertake actions and activities they would want to engage in and also be whom they want to be. So we thought that was really useful to understand the work of the orchestra and give voice to the members of the orchestra to express how they view their well-being and what they need to achieve that. So we carried out a qualitative research study. We focused on motivations and aspirations, how these are achieved, enablers and challenges, and also the future. We recruited 32 individuals, 22 of which were from refugee backgrounds, and we invited them to take part in interviews and focus groups. Now, as a starting point, looking at why did people want to be part of the orchestra, what were their goals, and how did this link to people's well-being? As we can see from the excerpt on this slide, people very much wanted to be part of the orchestra because music was very much part of their identity. It provided a link between their lives that they left behind, their new lives here in the UK, and how they viewed their lives in the future. It also related to how they had specific goals and aspirations that they wanted to achieve. It was also a coping behavior. It was part of improving their language skills and contributing to society. Thinking of what people access through the orchestra was very much a resource, and this was because of the assets and everything, the knowledge, the networks that people brought into the orchestra, but it was also a space for co-creating well-being, both through the therapeutic impact of the music itself, but also through the relational aspect, the bonds, the access to networks, giving voice to communities that weren't given voice in the past, but also providing a counter narrative to the very dehumanizing and negative way that refugees are portrayed in the public discourse. So it was very much a very empowering experience and a transformative experience on a personal and a collective level, and all of which enhanced people's sense of well-being. Certain factors enabled and hindered participation, both relating to the individual, such as motivations, their musical skill, but also the policies, and especially the hostile environment and the asylum-seeking policies, which provide a constant threat for people that they might be moved if they were going through the asylum process, which impacted their well-being, their ability to participate, but also what the orchestra could do, because they could lose musicians at any moment in time. So in terms of the enabling and hindering factors, the orchestra and what it provided in terms of participation, in terms of being flexible of what people could do and how they could participate, and the leadership in terms of co-producing instead of reproducing music that reflected everybody's identity were really, really important. Now, the key points that we can take away is that music does have a therapeutic impact, and that was really valuable to people. But the community music group went beyond that in addressing the social determinants and the broader determinants of mental health and well-being, in creating connections, bridges with the community, enhancing sense of agency and empowerment, and also how people portrayed themselves in the community, and that sense of agency and changing the narrative in how their communities were viewed by others. And I think this excerpt from this participant is very indicative of the impact on well-being and what it meant for participants to be part of the community, which was like happiness. People felt really powerful in seeing the impact their music had on those in the audience, and feeling that they belong because of that music that was co-produced to reflect the music sensibilities and identities of everyone present. So thank you very much.
That was amazing. So we all really enjoyed your presentation, and I'm going to suggest that we've not got too many questions just now, but what we might do is we might come back to questions for Christalla towards the end, and that way we can catch up a little. And I'm going to suggest we pass over to Tony and Ioannis with the next presentation. So thank you for your presentation, Christalla. So we're now going to move over to our final presentation, which is a joint presentation. So we're going to hear from Professor Bacolis and Dr. Tony Woods. And Ioannis and Tony are going to be talking about something that's very exciting, and that is the SHAPER study, scaling up our health arts programs, implementation and effectiveness research. And I'm told that this is the world's largest ever study into the impact and scalability of arts-based interventions on physical and mental health. And it's been launched by King's College London and University College London, and it's supported by a £2 million award from the Wellcome Trust. So Ioannis is the Professor of Public Mental Health and Statistics, and he's the founding Deputy Director for the Centre for Mental Health Policy and Evaluation at the Institute of Psychiatry, Psychology and Neurosciences at King's College London. And he's joined with Dr. Tony Woods, who is the Programme Manager of the SHAPER programme, and he's also based at King's College London, and he's bringing together a wide interdisciplinary team. And prior to taking up this post, he spent 16 years at the Wellcome Trust, where he was CEO of the Genesis Research Trust, and he was also a neurosciences lecturer at St George's University, London. So I'm now going to pass over to Tony and Ioannis, and we're looking forward to hearing about the SHAPER study. So over to you.
Okay, well, thanks very much for the introduction there, Simon. So yes, SHAPER, at the point of funding in 2019, I think it was the largest ever study. I don't know whether it still is, into creative health. But it basically, it was funded by Wellcome and was a program in response to the Creative Health and Arts and Wellbeing report by the All-Party Parliamentary Group on Creative Health, basically. So that report really highlighted the need for arts interventions, creative health interventions to be rolled out at scale. the problem that it highlighted was that many arts programs are delivered in small geographic or sort of healthcare pockets, and they operate at the fringe of the care sector rather than receiving mainstream funding. So Wellcome wanted to provide that mainstream funding, because that lack of sustainable funding, weak partnerships with commissioners, and unclear referral pathways really did sort of mean that, you know, this area is on the fringes of main scale health programs. So the idea was really to investigate how we could establish cost-effective, scalable solutions that can benefit the wider population. So there was a need, I think, for more, or there was a perceived need for more research into the effectiveness of creative health, as well as how we can upscale them, these interventions. And for those of you who are interested in that more that evidence of, you know, does creative health work, the best place to start is with this World Health Organization report by Daisy Fancourt, who was a collaborator of ours, and she looked at she did a huge review of over 900 publications, and this report is actually the second most downloaded WHO report in history, which really does show the interest across the globe in this area. So what did we do? Well, we took 3 known arts interventions, so they'd all been piloted prior to us becoming involved. Our job was to upscale and see if we could find a clinical pathway, with a view to clinical commissioning groups, as were then sort of ICBs now, commissioning them for in particular local areas. So we looked at postnatal depression, so a program called Melodies for Mums with an organisation called Breathe Arts Health Research. I'm going to show you a tiny few results of that. A dance for people living with Parkinson's disease with the English National Ballet, and a program called Brain Odysseys with an organisation called Rosetta Life. The first 2 on that list, we conducted clinical trials. And the third one was just a qualitative study on Brain Odysseys. To date, because the Brain Odysseys program finished before the other 2, that's been the most successful at being commissioned. It's been commissioned now in 6 areas, including Gloucester, Berkshire, Sussex, Gravesend, Stoke-on-Trent. Yeah, so that's really we've really sort of succeeded with that program. But I'm not going to say much more about that today, in the interest of time. So Melodies for Mums, why is it important? Well, postnatal depression affects up to 20% of new mothers, and pharmacotherapy is not always desirable, i.e., you know, breastfeeding women do not really want to be taking antidepressants, and psychotherapy is not always effective. So we'd already got some pilot data on a community singing program, and so we decided to roll this out. So I'm just very quickly show you some data from the study. We're still crunching through lots and lots of data, but this just shows the changes in depressive symptoms. So we assessed mothers' mental health at baseline, week 6 mid-intervention, and week 10, which is the end of the intervention. And then we followed up at points at week 20 and 36, i.e. sort of 8 months later. And the figures show the change in mothers' depressive symptoms on the EPDS, Edinburgh Postnatal Depression Score, from the start of the study through to week 36. And we found that mothers in both groups experienced a reduction in depressive symptoms during the intervention period. But once that period of active engagement with the research team and Breathe ended, mothers in the singing group continued to improve at week 20 and at week 36, while the control group plateaued. Now, some of you may be surprised that the control group had an improvement too, but that wasn't treatment as normal, i.e. nothing. That was these people, that cohort, the control group were called into the same community centres. They did exactly the same thing. They got support from each other. The only thing they didn't get was the music, which they got at the end, and that wasn't included in the study. So that's why both go down. But you can see that the stronger effect is obviously with the music. And then again, this is just pick some graphs at random. This is looking at the proportion of maternal comments toward the infant that had a negative connotation. So we videoed the women, and we found that mothers in the singing group experienced a sharp decrease in negative comments during the intervention period, while mothers in the control group actually increased in their negative comments, overall highlighting the quick and sort of meaningful impact that the Melodies for Mums had on mums and their relationships with their babies. We also looked at markers of bonding as well. And then we looked at some biological responses. We looked at cortisol levels in saliva. So we took samples from mothers at their first and last session, pre and post session, to look at their levels of cortisol, which is the main hormone of the stress response. And on the left, you can see a figure showing the cortisol concentrations of mothers in the singing group. In the black is the pre and post their baseline session, and the striped is pre and post their final session. And as you can see, the mums who did the singing had a nice decrease in their cortisol at both time points, which indicates a reduction in stress at both baseline and week 10. And then the figure on the right is the control group, and we can see that they only experienced this reduction in cortisol at their first session, indicating that the control group did not experience the same prolonged relaxing effect that the singing provided. So that's just a tiny snapshot of some of the results with our clinical trial. In postnatal depression. The English National Ballet Dance for Parkinson's trial was smaller, and in fact COVID really sort of hit us hard, which meant we couldn't recruit the numbers but we wanted to, but we did recruit 78 people with Parkinson's, people living with Parkinson's, and we divided them into 3 groups: mild, moderate, and advanced, and they did 12 dance sessions. So they did 12 weekly sessions of dancing. Again, there was a control group there. What I can say is that we saw improvements in both motor and non-motor symptoms of Parkinson's, including large decreases in pain and increases in well-being. But that data, as I say, we're still working on that data. But I think one of the unique aspects about our study was that it was not only looking at the effectiveness, but we're also looking at the feasibility and acceptability. And Yanis is going to tell you about that implementation science, as it's called, from now on. So, Yanis, over to you.
Thanks very much. Thanks, Tony. So as we mentioned, the main aim of the SAPER program was to look into how to programs like within the how to programs the Melody for Mums and the Dance for Parkinson could be embedded within existing clinical pathways within the NHS. So we were primarily had a dual focus, not only on the clinical effectiveness and cost effectiveness of the 2 programs, but also we wanted to evaluate the implementation effectiveness, that within the context of hybrid trial designs and mixed methods approaches. So today we'll try very briefly, as we know we're running out of time, we'll present some findings from the qualitative interviews that we had from more than 60 participants and professional stakeholders. These were primarily analyzed by Dr. Alexander Barton and Dr. Julie Williams. Next slide, please, Tony. So the term of active ingredients which we used in order to evaluate the programs has been stemming from pharmacological research, but we are also now it's gaining traction around non-pharmacological research, and has become popular of what is the active ingredients that they're seeking into an intervention, and the components that make an intervention implementable. And this is something that it is regained traction, especially in the behavior implementation research field. So our programs are made of a lot of different ingredients, and we summarize that, our team has summarized that within the innate framework around contexts, peoples, and project ingredients. And the context relates to the activity setting that comprising the environment the intervention takes place, the resources and surroundings. The people category is around how people interact with engagement, with activity. And the project components relates directly to the attributes, quality, and characteristics of an arts and cultural activity. Next slide, please. So within that, within the context ingredients, we share some examples from both the Melody for Moms and Dance for Parkinson programs, with some overlapping elements, with some quotes that support them. In brief, participants identify different barriers such as travel distance and costs. However, they appreciated the safe environment on both programs, and also the fact that some of the moms that attended the Melody for Moms programs have found it very hard to reach the program around more kind of hard to reach groups, like mothers that were more socially withdrawn. Next slide, please. So that's some of the quotes that we had from the qualitative research. Next slide, please. And then for regarding the people's ingredients, regarding that, many moms valued the structure and valued the social time and how staff were interacting with participants. And within the PD ballot as well, they felt that the interacting with the staff was quite a major importance within the activities of the intervention. Next slide, please. And these are some few quotes, and some within the project ingredients as well. We have, they felt that for both Melody for Moms and the Dance for Parkinson program were easy enough to do when they were like tired and they have to travel a lot. And also they were surprised how much actually they would like to engage with the activities and the dance aspects of it. Next slide, please, which is the concluding one as well. So within that, some of the summary conclusions that we presented today, we saw that Melody for Moms were, compared to the control conditions, were able to reduce depression, system stress, and improved mother-child relationship. With PD Bali, we have some preliminary findings that they improve motor and non-motor symptoms. In Parkinson, they were both qualitative and quantitative research that were considered acceptable, feasible, and appropriate. People and projects ingredients were key and defined as key ingredients for implementation success, and implementation strategies for future rollout and spread, including raising awareness of the two programs and ensuring that both people that are delivering the intervention, but the people that commission the intervention are supported within that. Thank you very much. That's all from us.
So Tony, Ines, thank you so much for your presentation. So we had a dual presentation there, some fascinating work, and I think we've got time for just one question, and then I'll wrap up today's session. So we've got a question from Professor Vicky Karku, who is at Edge Hill University in Liverpool, and she has said the singing study is currently taking place in Europe, so that might be information, it might be something you know about. Can you say something about how this study is shaping up?
The one in Europe?
Yeah.
Well, I don't know too much about it, only that it came about via, I think, the WHO. It's a study I'm thinking of. So Breathe Arts Health Research were then asked by the WHO to roll out the study in Romania and also in Scandinavia, and so they've been doing that, but we haven't been taking part in that study. So we haven't been doing the science behind that. So that was just a rollout. So I'm not sure which other study it would be.
Okay, thanks for that answer. That's great, Tony. So the next question comes from Anne Ferry, and Anne says, this research focused on scaling up existing arts programs, but is there also some benefit in these smaller local interventions that can be tailored completely to the local context? So we've got a localism question here.
Yeah, absolutely. But the problem is funding. So what tends to happen is they get small amounts of funding. They run for 12 months, and then it has to pack up. And so that's been an issue that's right across the country, and it's something that I noticed when I was actually funding these programs myself when I was at Wellcome Trust. So there's loads of great local activity. There's some fantastic arts organisations doing wonderful things, wonderful programs, but as soon as the money runs out, it all disappears. And so it's really, the key is thought to be upscale and get funding from the ICBs and get those commissions, so that when the actual project money runs out, the programs don't disappear.
Also, I mean, like, as part of the story, just to add on what Tony said, I mean, like, from a kind of a science methodological perspective, I mean, like, all the scaling up we want to do with this intervention is kind of to ensure adaptability in different local contexts, because it's important, the global and the local as well. And although I mean, the funding cannot, as I said, like, I fully agree that the funding will not be there for the local context. We need, like, kind of more like embedded within the NHS services, but it wouldn't be the same, like tailoring these studies across Europe, across different local contexts within the UK. So this was the part that why we were interested so much on the implementation side, and we gave equal focus not only on the clinical and effectiveness, but on the implementation side of these interventions as well.
Okay, that's a great answer. And I'm told that we've got time for a couple more questions. So we've got one here. And the question is, will the Parkinson's disease ballet program be created that practitioners can train in and then deliver the sessions? So this is about implementation beyond the study, I think.
Yes, I mean, dance for Parkinson's in many different guises is quite prevalent across the world. I mean, certainly in the US, it's taken off, and there's lots of places in the UK. I know that the English National Ballet have been training lots of practitioners up, so they've got sessions in places like Oxford, Ipswich, Liverpool, and across various other places. So it is more widespread than just at the English National Ballet in the East London. So that's their goal is to roll it out as widespread as they can across the UK. So yeah. But they have put a trademark on PD ballet per se itself. So I'm not sure about other people just going and sort of copying exactly what they do, but that they are controlling that.
Yeah, that's so interesting. Now, I was thinking we had a question for Christalla. So, Christalla, I stalled a little bit because we had to move into this session, but I'm just looking back, see if we can find a question for Christalla. And just to give Christalla the heads up that she's got the next question.
Hi, Simon. It's Kate from Yorkshire and Humber. I found the question.
Hey, do you want to read it out?
Yeah, it was. I'm not sure who asked it, but it says that the talk was really interesting. And did the sometimes transitory nature of the lives of asylum seekers and refugees affect the participation of the cohort?
Great question. Who asked that? So, Christalla, over to you.
Yes, absolutely. So it made our recruitment a bit more challenging, because it meant every time we attended rehearsals to recruit participants, different people were attending each time. And it also limited the methods we could use, because we couldn't follow people over time as there was such a dynamic sort of participation. So
That's a great.
Yes, it definitely presented challenges. Yes.
And I think the answer gets to lots of the interventions that we've seen today. So listen, if it's okay, I'm going to draw things to a close. I've got a couple of comments just to draw together some of the presentations that we've had today. I mean, the first thing is I've been blown away by the quality of the presentations and the quality of the science that we've seen here today. And it's really nice to see creative arts evaluated and contemplated in this way. We particularly want to thank soon-to-be Dr. Briana and wish her well on her journey towards a doctorate. Thanks Dr. Christalla, Dr. Tony and Professor Ianis. So we had some great presentations. So thank you for your presentations. Thank you for keeping to time. And we've seen some really amazing examples here of research rigor, the appropriate use of mixed method research, and the alignment of the priorities of people who use services. We've got some great evidence of co-production, and one of the things that I picked up on was cultural participation, which we don't see so often in some of the research within our ARCs, but it's really reassuring to see that. And we've seen some really great and compelling evidence of the potential for creative arts in general. So really exciting area of development. So it's great to see the ARC support the career development of our early careers researchers and our doctoral students. So I think this is a way in which we can build capacity within the ARCs, and it was nice to see in particular Briana's work in that respect. And it was great to see the larger funders actually getting behind the evaluation of the arts at scale and with the appropriate resources to do this with ambition and scientific rigor. So thank you to the Wellcome for supporting the study we heard about there. And it's great to see this become a focus of the ARCs. So I've been involved in the ARCs and the predecessors to the ARCs, the Clarks, and I've got to say, we've seen a process of evolution over the last 2 decades in the way in which the scope of interventions that we think about and how community co-production can be brought to bear in trying to improve the lives of people who use mental health services. So I think we can celebrate the quality of the work and the fact that we're on a journey in today's meeting. So I want to thank everyone in particular. I want to thank all the people that have been helping make this happen behind the scenes. These things don't happen by accident. So particularly thanks to the team from the ARCs that have been making this happen. And we're looking forward to the next ARC webinar. So be sure to put that on your diaries. The next ARC webinar is going to be on the 11th of June. And the theme for the next webinar is going to be exploring lived experience with creative art. So thank you again and enjoy the rest of your day.